Muchas gracias a la doctora Milena. Vamos a por la siguiente conferencia, titulada Punción subcutánea de Fu y la acupuntura tradicional en el tratamiento del dolor crónico de rodilla. Conferencia impartida por la doctora Xu Ping, desde el Reino Unido. Doble licenciatura en Medicina Occidental y Medicina Tradicional China y máster en Acupuntura Clínica por la Universidad de Medicina Tradicional China de Hubei. En los últimos 15 años ejerce la acupuntura, la fitoterapia tradicional china y medicina integrativa en consulta propia. Miembro del Consejo de la Asociación Europea de Acupuntura Subcutánea de Fu y tutora de formación en FSN. Miembro del Consejo Ejecutivo del Comité de Especialidades de la FSN.
Hello, my name is Ping Xu. I am a qualified traditional Chinese medical practitioner in London. It is a great pleasure for me to have the invitation from the Association of Sanitary Acupuncturists to attend the conference. So today I would like to share with you is the discussion of Fu's subcutaneous needling and the traditional acupuncture in the treatment of chronic knee pain. So let's say, what is FSN acupuncture? The full name of FSN acupuncture is Fu's subcutaneous needling acupuncture, which is a newly developed acupuncture therapy. It is performed by inserting a modified acupuncture needle to stimulate subcutaneous loose connective tissue. It treats mainly musculoskeletal complaints and other conditions. FSN acupuncture is invented by a Chinese doctor, Zhonghua, in 1996, while he was working in the first military medical university in China. The FSN acupuncture stems from traditional Chinese acupuncture, but now is a modern therapeutic approach for a variety of illness, especially for musculoskeletal painful disorders. In some cases, FSN acupuncture could provide immediate and significant relief of the pain more effectively than anesthesia. So now let's say the foundation of this theory in FSN acupuncture. Although FSN acupuncture derived from traditional acupuncture and its meridians theory, there was a shift towards a theoretical basis based on modern medicine, mainly on histology, physiology, and anatomy, with the development of FSN acupuncture. So we have to point out two terms here, and they are energy crisis theory and MTRPS. Which FSN acupuncture took as reference from the initial stage of its development. So let's see the two terms. Energy crisis theory, which is a contraction of a muscle segment, creates a demand for energy and cuts off local circulation. Therefore, improving local circulation is crucial, but how to improve the crisis clinically is not easy, as an understanding of energy crisis is limited. MTRPS are hard, discrete, palpable nodules in taut band of skeletal muscle that may be spontaneously painful or painful only on compression. Unfortunately, clinical study, theories, diagnostic criteria, etc. of the muscle pain and MTRPS often seems disjointed and confusing. During the development of FSN acupuncture, Titan muscle theory is established to make clinical diagnosis and practicing simpler and more effective. So let's see what is Titan muscle in the perspective of FSN acupuncture. Titan muscle is a muscle that is still in tense state pathologically when patients are relaxed under the condition that the central nervous system functions normally. FSN can relieve the pathologically tense state of tightened muscle and then improve the local circulation. Okay, so this picture showed us the structure of FSN needle. And so they are designed for single use and is made up of 3 parts. From the bottom, we can see a solid needle core. So we can see the needle core is much thicker than the traditional needle, but don't worry about it. We'll talk about the manipulation later. The middle part is the soft casing pipe. It could cover the tip of the needle stick until the needle stick is pulled back by 3 millimeters during the manipulation. Then the tip of the needle stick will not hurt the surrounding organs during the swinging movement. So on the top of the picture, and that is a protective sheath. So that sheath shields the needle core and the casing pipe from collision with other things, and it also keeps the FSN needle sterile. Okay, now we can see the brand new things, the needle on it. And this is a device for assisting needle insert, the very smart design for FSN needle inserting. Because they are rich, free nerve endings spreading on epidermis and dermis layers. So this gadget could make the needle go through epidermis and dermis very quick to reduce a chance of a pain and the rich subcutaneous layer precisely for the treatment. All right, next 2 pictures will show the first of the features in manipulation. Now we can see, unlike traditional acupuncture, which is following the theory of meridians, acupoints through skin, subcutaneous tissues, muscles, and even rich bone, the FSN acupuncture is using a special trocar needle, following tightened muscles theory, working on only the subcutaneous layer. The following the feature is the selection of insertion area. Traditional acupuncture are located directly on the afflicted or painful area. However, FSN acupuncture acts not on afflicted area. The insertion sites are mainly around or near relevant tightened muscles, which is around the afflicted spot or nearby limb, but not directly on the afflicted area. Okay, so this picture showed actually once the needles go in, the technique of manipulation, which is called the swing movement. Traditional acupuncture is using lifting, thrusting, and the twirling and rotating manipulation vertically. But the FSN acupuncture is using a smooth, softer, fan-style wiggling movement, which means the needle swinging from side to side horizontally in subcutaneous layer. Okay, except above the features, there are new words we can see is Reperfusion Approach. So the Reperfusion approach actually is the FSN acupuncture specific approach beside the needling technique. Back to the energy crisis theory, the contraction of a muscle segment creates a demand for energy and cuts off local circulation. Thus, improving local circulation is crucial, but how will improve the effect beside the needling? So it is illustrated by a famous demonstration from Dr. Fu, the changing in the hand's skin color when the fist is clenched and loosened alternatively. You can try it now or later on, and you can see the color of your palm changing. So now we can see the Reperfusion approach refers to the mechanical methods that extend, contract repetitively the relevant muscles to improve the local circulation in non-inflamed ischemic tissues, especially in musculoskeletal injured tissues. So simply to say is, the RA is to make the targeted tightened muscles contract and extend. But it's different from reperfusion injury, which refers to tissue damage caused when blood supply returns to the tissue after a period of ischemia. Well, based on the features above, we can see the relationship between traditional acupuncture and FSN acupuncture is the still vs dynamic. Traditional acupuncture, the patient have to keep still position. Only acupuncturists take a needle manipulation. Because the needle is through skin, subcutaneous layer, and muscles. Therefore, the patient have to stay still. Otherwise, there will be risk in breaking needle, causing pain, and then bleeding, even injury or damage of tissue or organs. So normally one traditional acupuncture session is at least 20 minutes. Then the feedback could be achieved. But FSN acupuncture use the trocar needle to stimulate the subcutaneous layer by doing horizontally sweeping manipulation to achieve the desired effect. While doing the swinging movement, the patient will be asked to cooperate with the FSN acupuncturist for the reperfusion approach. Because FSN swinging movement is only around 2 minutes, and also combined reperfusion approach is also very short time. So FSN could provide feedback much quicker than traditional acupuncture and medications could. So the practitioner could modify the diagnosis and treatment accordingly, which will bring them much more benefit for the patients. Okay, now after we're talking about features, we can see the different sensations from the two different acupunctures. Sure. Traditional acupuncture manipulation is using the reinforcing and reducing method for the qi. In traditional acupuncture, the qi is considered an omen of its curative effect. Most acupuncturists try to manipulate a needle to induce the qi, but FSN acupuncture manipulation is definitely not for the qi. As we talked above, the rare free nerves ending and the little capillary vessels spreading on subcutaneous layer. So therefore, little chance to cause pain or any harm. So FSN aims for a patient not to have sensations of soreness, swelling, or numbness, or for the acupuncturist not to feel any mild resistance or needle grasp feeling. Okay, so this picture shows FSN indication trees. So in a very short time, with the development of FSN indication, so although FSN is relatively new, it has developed at great speed. From the very beginning, FSN mainly used to treat only soft tissue injuries in the forelimbs. But now we can see the totally different. In the indication tree, there are also visceral and non-visceral diseases. All right, now we understand that the FSN acupuncture is working on subcutaneous layer through swinging manipulation, targeting on tightened muscles. We'll sum up the different essential features of traditional and FSN acupuncture. The first one, they are based on different theories. Second, they use different kinds of needles. Third, their manipulation is different. Now, we finished the introductions of the FSN acupuncture and also compared some of them with the features with traditional acupuncture. We'll talk the chronic knee pain. We all know the knee joint is the largest joint in the human body, and it's also the second to the shoulder joints in complexity. Clinically, chronic pain might be one of the most common complaints. So let's see the chronic knee pain's clinical manifestation. It's quite often being seen in middle-aged, obese, more common in women. The characters of the knee pain are following: intermittent at the early stage of the illness and persistent at the late illness. The pain is worse at night and while fatigue. The pain gets worse while the knee moves and is more severe when walking up and downstairs. There could be limitation of knee movement, even claudication. In knee joint movement, some cases can have popping sound, friction sound. Some of them can have swollen joints, even deformity at the very late stage. All right, now we see the assessment and diagnosis. Traditional acupuncture is based on meridian and points, and FSN acupuncture based on tightened muscles. So now we have to point at a little bit specific things in FSN acupuncture. Clinically, there are symptoms and the cause, obviously. Traditional acupuncture, to use the cuppings, medicated plasters, etc., located directly on the pain spots of the knee joints. Because they are free nerve endings that feel cold, hot, light touch, and a painful stimulation are mostly distributed in joint, capsules, tendon, ligament, fascia, etc. But the pain spots don't mean it is a real cause of the pain. However, in FSN acupuncture theory, the cause is tightened muscle that attached to the joints via tendon pulls the joints to cause pain. So the target of the FSN acupuncture is tightened muscle. Therefore, FSN acupuncture point selection mainly depends on the different relevant muscles or situations of the disorder, but not directly on the afflicted area. Okay, so this picture showed us a very specific test from FSN acupuncture. It's called pushing patella test. We're going to use the right knee as an example. So the test we're doing is diagonally from the 4 directions of the knee joints, slowly and smoothly push the patella according to the pain spots from patient or the friction feelings of the acupuncturist's hand to search the relevant tightened muscle. So let's say from the pain on upper and the lower medial side of the knee, the muscles related with are soleus, medial head of gastrocnemius, femoral adductors, vastus medialis, and sartorius. And if the pains on upper and the lower lateral side of the knee, the muscles related with are peroneus longus, lateral head of the gastrocnemius, the tensor fascia latae, and vastus lateralis. These muscles are just directly involved in knee joint movement. However, clinically, the chronic knee pain is more complicated, involved more muscles and other afflicted area. So clinically can be more complicated, I mean. Last one. Once we understand above, so the treatment actually is easier to explain. In traditional acupuncture, it's mainly on the pain spots. So using channel points, extra points, and Ashi points. And FSN acupuncture, not on the pain spots. It's according to the functional anatomy, the tightened muscle are the cause of the chronic knee pain. Therefore, the tightened muscle related or relevant are the target of FSN acupuncture. So we have to see if obese patient or patient suffering from systemic diseases such as diabetes, and the long-term effect is often poor. So because of time limited, so I couldn't talk the FSN acupuncture in treating chronic knee pain in full detail. I hope this topic is useful. Let me now close by wishing you all a delightful and a healthy life. Thank you.
Muchas gracias a todos los ponentes. Vaya conferencias más interesantes que estamos teniendo, ¿verdad? ¿Cómo va el día? Confiamos desde la organización que os esté resultando satisfactoria la asistencia virtual a esta jornada. Organizada con ganas y con trabajo por parte de la Asociación de Acupuntores Sanitarios y por parte del comité organizador. Quiero aprovechar en este momento y pediros que os unáis a la Asociación de Acupuntores Sanitarios. Nuestra página web es acupuntoressanitarios.org y podéis también entrar en la página de Facebook Amigos de la Acupuntura. Esta página la regimos también desde la Asociación de Acupuntores Sanitarios. Bueno, pues ya la jornada va cuesta abajo y vamos a hacer este último descanso de 15 minutos para coger ya el último impulso. En este tramo de descanso, nuestros patrocinadores principales van a exponer sus productos y servicios que nos van a resultar interesantes para nuestra práctica clínica diaria. Y recordad lo que ya os hemos dicho antes, la acupuntura es ciencia.